Vera Clark here. Continuing my assessment, I ran out of memory on my other device, so I had to switch devices. So I left off, I was assessing my patient here for Burkophony, so I'm asking her to say 99.
99. 99.
I hear a muffled sound, which is normal. I would also perform asking the patient to whisper 1, 2, 3. She would do that, I shouldn't be able to hear it. I would also do egophony, which I would have the patient sound like, say E, and I would hear ah in my stethoscope. Okay, so moving on now, Cole, I'm going to have you turn around and face me. Going to do the assessment of the peripheral vascular system. I'm going to be assessing the cusps and the 4 T's. So I'm going to be checking for each extremity for color, ulcerations, swelling, pitting, edema, scars, temperature, texture, pudor, and tenderness. So we're going to start with the left arm. Color is normal. No ulcerations. No swelling or pitting edema. No scarring. Any tenderness?
No.
Temperature is normal. Texture is normal. Pudor is normal. I'm going to now assess the right arm. Color is normal. No scars, no pitting edema, no ulcerations. Temperature feels normal. Texture feels normal. Pudor is normal. Any tenderness?
No.
Okay. I'm going to move on to the left leg now. Temperature is normal. Pudor is normal. Texture is normal. Any tenderness?
No.
No ulcerations, no pitting edema. Color is normal. Just a little bit of scarring here at the knees, probably from childhood whatnots. Skateboarding. And let's see. Checking here. Any tenderness?
No.
Okay, no pitting edema. Texture is good. Color is good. Pudor is good. No scarring really, except for some minor scarring. Color is good. No ulcerations. Okay, so I'm going to now palpate your pulses. So I'm going to start with your temporal pulse. Taking 2 fingers, I'm going to place them here on the temples, and I'm going to assess bilaterally. I want to assess this as a 1+. It's a little bit hard to feel, but I can feel it. Okay, I'm now going to assess the carotid artery. We do not do that bilaterally, so I'm going to place my 2 fingers here on the left side. That's definitely a 2+. I can feel that easily. Checking the right carotid. That's a 2+ as well. Moving down to the brachial artery. That is going to be on the inside of the elbow, on the ulnar side. Lightly press. I feel a pulse there, but I'm going to rate that as a 1+. That's a little bit hard to feel as well. Assessing the right brachial artery. I'm going to rate that as a 1+. Moving down to the radial artery, which is going to be inside of the wrist, the ulnar side. I'm going to place 2 fingers. I feel pulse, and I would rate that as a 2+. Assessing the right ulnar pulse. I'm going to rate that as a 2+ as well. Okay, go ahead and lay back for me. Okay, I'm going to assess the femoral artery, so if you can lay down, you're going to feel me assess in the inguinal area, horizontally and vertically. I would rate that as a 2+. Horizontal and vertically assessing the femoral artery of the right side. 2+. Moving down to the popliteal of the left side behind the knee, I'm placing 2 fingers. I feel a pulse, but that's going to be a 1+. That's a little bit harder to feel. Assessing the right popliteal. I am able to feel a pulse. Again, that's going to be a 1+. That's a little bit hard to feel as well. Moving down, dorsalis, pedis. It's going to be the top of the foot. Make sure she knows that I know what I'm doing. Okay. Okay. I would rate that as a 2+. I can feel that easily. 2+ on the right side as well. Posterior tibial is going to be on the inside of the ankle, just below that ankle bone there. I would rate that as a 2+. I can easily feel that on the left side. 2+ on the right side as well. Now I'm going to assess for patency of the ulnar and radial arteries. So Cole, what I'm going to do, can you sit up for me, please? Okay. So hold your hand up for me. I'm going to block the radial and the ulnar artery until I notice a change in color in the hand. Does it feel a little numb and tingly?
Yeah.
Okay, so now I'm going to release the ulnar side. And I did see color return, so that means that the ulnar artery is patent. I'm going to assess the capillary refill in the fingers and the toes, so I'm going to pinch the left fingernail and fingertip. Capillary beds fill up quickly on the left. Checking now the right fingertip. Capillary beds fill up quickly there as well. Let me see your left toe. I'm assessing the left toe. I am pinching the left toe. Capillary beds fill up well and fast. Assessing right toe. Okay, upon release, the capillary beds fill up quickly. Okay, now I'm going to perform the bedside neurological examination. So what I'm going to have you do again, Cole, is if you could lay back for me. Okay, so pretend that you're in the hospital bed. You have your eyes closed. Cole.
Yeah.
Okay, so Cole is responding. She's alert. She's fully conscious. Her eyes open spontaneously. She responds to my voice and verbal stimuli. She is, can you raise your hand for me? Able to follow commands. Can you, she's able to track my fingers. Let's see. Is that a little painful?
Yeah.
She's able to respond to painful stimuli. And if she were unresponsive, she would not be able to respond to any stimuli at all. So Cole, can you tell me what your name is?
Cole.
What's your occupation?
I am a sales representative.
How old are you?
I'm 39.
Where are you right now?
In the hospital.
What city?
I am in Louisville, Kentucky.
And what year is it?
2020.
Do you know what day of the week it is?
It is Friday.
And what month is it?
It is now June.
It is. Okay, go ahead and sit back up for me. First thing I'm going to ask you to do is I'm going to test each of your hands separately. With your your left hand, can you squeeze my finger as tight as you can? Good. And now, right? Excellent. Okay, go ahead and lay back down. So what I'm going to do is I'm going to have you lift your leg while I press down. So I'm going to assess your muscle strength and your motor response. So
Okay.
if you can, go ahead and lift your leg. Good. Now lift the other leg. Excellent. All right, so I'm going to perform a couple tests on you. You're going to feel me touch a piece of cotton on your skin, over your body, with your eyes closed. I want you to tell me when you feel it. I want you to say when or now, okay? Go ahead.
Now. 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 Now.
Excellent. Okay, so now we are going to do a superficial pain sensory response test. So what I'm going to do is touch you with either something sharp or something soft, and I want you to tell me if it's sharp or soft, okay? All right, go ahead.
Sharp. Soft. Sharp. Was that wrong?
Yeah.
That's soft. Sharp. Sharp. Soft. Soft. Sharp.
Excellent. Okay, so go ahead and sit up for me again. We're going to assess your eyes. So we're going to use PERLA, which is pupils are equal, round, react to light, and accommodation. So the first thing I'm going to do is I'm going to assess your pupils. They are round. They are symmetrical. They are equal in size and shape. They are reacting to light. So what I'm going to do is I'm going to shine a light and assess the constriction of your pupils, okay? The left pupil constricts. The right pupil constricts. Okay, now I'm going to flash this into your right eye and I'm going to assess your left pupil. I'm sorry, I'm going to put this in your left pupil and assess your right pupil.
Oh.
Ready? Excellent. So upon shining the light into the left pupil, I am seeing a constriction and reaction on the right pupil as well. Let's reverse this. Okay, so I am shining the light into the right pupil and I am seeing a constriction with the left pupil, which is normal, how it's supposed to be. Okay, so what I'm going to do is I'm going to have you focus on my finger. Okay, out here in the distance. Okay, I do see your pupils dilate. Now I'm going to move this closer. I want you to follow this. I do see the convergence of the eyes and a constriction of the pupils, which is exactly what's supposed to happen. Okay, so normally we would have a little reflex hammer, but we don't. So I'm going to pretend with my off bite and itch relief, which you really need in Kentucky.
You have your little thing?
I know.
That looks like a...
So what I would do is I would tap right below the patella, and the patient should kick their leg out. So assessing the left and now the right. Excellent.
Right has always been better.
I would rate that reflex as a 2+. That was normal. Okay, so moving on, I'm going to do an assessment of your abdomen. So if you can, lay back down again. And what I'm going to have you do is hold the camera for me so my instructor can see that I know what I'm doing. First thing I'm going to do is I'm going to start with identifying landmarks. So I'm going to start with the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. I'm going to inspect your abdomen. Whoops, sorry. Okay, so I'm looking for color, which is normal, contour, which is normal, lesions. I did see a little bit of a lesion here. She has an allergic reaction to metal from her belt and continues to wear that belt every day and has lesions and definite scarring. I do see pulsations, but they are not abnormal. I don't see any drainage, any ulcerations. Umbilical region is healthy, no drainage, no signs of herniation. Can you cough for me? No signs of herniation. Okay, so I am now going to start in the right lower quadrant using the diaphragm of my stethoscope to auscultate your bowel sounds. So starting in the right lower quadrant. Borborygma signs are present. Little hypoactive. Okay. Normal findings there. I'm now going to auscultate for vascular sounds, checking for bruits over the aorta, renal arteries, iliac arteries, femoral arteries. Using the bell of my stethoscope, now going to check the aortic artery. Renal. Renal. Iliac. Iliac. And femoral. No evidence of bruits. Okay, I'm now going to percuss the abdomen, looking for masses, excess air, and fluid. So the first thing I'm going to do, start with the right upper quadrant. Okay, I am now going to percuss the abdomen, looking for tympany and dullness. So I should have tympany over most of the abdomen except over the liver. So I am going to percuss the abdomen for the liver. So I'm going to start here. So the liver is giving me a nice dull sound. And I know when I've moved away from the liver because I hear more of a tympanic sound. The spleen should not be detectable unless there was splenomegaly, which means it was enlarged. So midclavicular line on the right side is going to be where the liver is, and spleen's going to be here. Yeah, I don't hear any sounds there, except for tympany, which is normal. Okay, so now I'm going to make sure I'm doing this properly. Look for the left anterior axillary line. Just there. Okay. And now I'm going to palpate the abdomen, noticing any masses, tenderness. I'm going to do this lightly. Little tenderness? Yes. She's having some GI issues right now. Okay. All right. Now I'm going to do it a little bit deeper, starting with the right upper quadrant. Any tenderness?
No.
Right lower quadrant? Tenderness?
No, just ticklish.
Left lower quadrant? Any tenderness? Yeah.
Yeah.
Left upper? Tenderness?
Yeah.
Tenderness, but I don't feel any masses. I'm now going to palpate the liver. Right upper quadrant. Kind of hook it. Okay. Again, the spleen should not be detectable. I should not be able to feel that unless it's enlarged, and then there's a problem. I'm now going to palpate the abdomen for abnormal separation of the rectus muscle. Okay. The rectus muscle is intact. I do not feel any abnormal separation at all. I'm going to check the kidneys. So palpating with my two hands, one on her posterior region, 1 on her anterior region. I'm going to kind of squeeze to feel the kidneys. Okay, I'm going to move to the other side. Doing the same on the right side. Any tenderness?
Mm-mm.
Okay, no masses, no pain. All right, go ahead and sit up for me.
Is that back?
Yeah. Okay, so now I'm going to perform I'm going to assess rather, via percussion, the costovertebral angle tenderness blunt percussion test. So what you're going to feel is me basically assessing you for any kidney pain. So I'm going to place my left hand on the posterior portion of her body. I'm going to take a fist and I'm just going to hit. Any pain?
No. No.
No. Great. Okay, Professor Randall, that concludes my final assessment. Again, thank you for everything that you've done for us. You've been a great professor, and I really appreciate you. Thank you.